Let's face it, we all know that we're facing a very serious economic crisis in this country right now, and a part of this problem is without question rising medical costs. According to a report by the Center for Studying Health System Change, more than 57 million Americans of all ages reporting problems paying medical bills in 2007. It's a problem Heidi and Dwayne can't escape.
Well, the toughest part about keeping everyone healthy is the cost. We still have to meet $3,600 first before they'll cover anything. Okay, now that's a lot.
Yeah. I feel like I'm an educated person, but when it comes to healthcare, I feel completely uneducated. It's very confusing.
Our medical expenses obviously are our kids.
I've got Motrin for fevers and aches and pains for colds. I've got acetaminophen.
Just in the cabinet, you're probably talking $100 there, another $100 inside this bag.
Worst case scenario, we're looking at almost $10,000 a year.
And now I don't go to the doctor that often, and let's hope now that I'm getting older, nothing happens.
But that's my fear. We're getting older, so things are going to happen.
Right.
Any kind of elective procedures or elective alternative care is sort of out of the picture for us at this point because we just can't afford it. I would like to ask the doctors if it's possible to save money on health care without sacrificing quality.
Here to offer some advice to Heidi and Dwayne is Robert Hendrick. He's author of My Healthcare is Killing Me, and so many people feel this way. What do people out there need to know about healthcare costs in general?
Well, first of all, they don't need to get intimidated by their healthcare costs. There's a lot of things that they can do, but the big thing is that we're getting to a point where we've got to become consumers. When we go out to buy a car, we go with information. We know what car we want. We know what the price is we're going to pay for it. Healthcare is a little bit different at this point. Everybody goes out and they're surprised, and it's that fear of the unknown that lends them to that point where these folks have gotten. They're scared because they don't know what to expect. And so what they've got to do is they've got to get the information. There's information out there now about price. There's information about quality. There's information about patient satisfaction that they can get access to. And they can arm themselves so that they can actually become consumers just like they would if they were going to buy a car.
And Heidi and Dwayne are a very typical couple with the same concerns as almost all couples in this country. So what advice can you give them in their particular situation?
Well, Heidi and Dwayne, we talked a little bit backstage, but there's a lot of things that you can do to save money. And you don't realize it, but the things that are out there in terms of healthcare are negotiable to some extent. You can negotiate with hospitals if you have a large bill, and they will give you a discount on that. You can even set up payment terms with them to get a better rate. And then when it comes to prescriptions, I saw all the prescriptions that you had in the video, and that's a lot of them. That's a huge cost. And if you have parents who maybe are on Medicare and hit the donut hole, for example, that can be a really big cost. You can call around. You can check the prices. Prices between pharmacies can vary as much as 20 to 40%.
And sometimes people don't know that non-generics and generics are pretty much the same thing.
Exactly. They're pretty much the same thing. That's another cost savings. A lot of them will match prices, so it's really as simple as calling up and saying, gosh, I found it cheaper here. Will you match that price? And then going for the generics can make it even less.
So, Robert, show us your new budget for Heidi and Dwayne.
All right. So, Heidi and Dwayne, what we've got is we looked at your prescription drugs, and here are some of the things that you're taking. And we looked at the local price versus the preferred price. And so we found by calling around what were some of the better prices that you could get, and if you went to generic. And those are some of the cost savings that you could actually realize. And then on the far right there, what you'll see is your entire savings for the year. And so you're looking at about a $2,500 savings for the year alone.
Wow, that's great.
And then if we can go to the next slide, here's some episodic costs. These are some of the other prescriptions that you're using. The Z-Pak antibiotic and the amoxicillin, same thing. You see what the price is, what it could be potentially if you went to generics, and what your total annual savings might be. And then we looked at the last slide, or the last slide with the hospital costs on it. We looked at your appendectomy, and we looked at your broken leg. Dwayne had a broken leg, and Heidi had an appendectomy. They both went to a hospital that had what we have as a good rating. We rate hospitals on a good, better, best value rating, and that's based on price, on outcomes, and on patient satisfaction. And what we did was we compared that with another hospital that had a better rating. And the reason that hospital has a better rating is because they may do things a little bit more efficiently. They may diagnose you more quickly. They may get you treated more properly or get you the right treatment the first time around, resulting in getting you out of the hospital faster. And that's what we define as a better quality hospital. And that gives you the savings on those. So That gives you a grand total savings of our next slide of potentially as much as $18,000. And that's you and your insurance together. And that's what we're all about, is getting you the information. That's why we put the book together that we have, so that people could be armed with the information. You can literally just pick up the phone, make a call, and say, can I get my bill reduced? Can I negotiate with you? The hospitals are willing to negotiate to get their payments. So that's what it's about, is just getting the information, feeling comfortable with it, because it's your health care. I mean, if you're not going to get involved with it, it's your health care, it's your finances. If you're not going to get involved with it, nobody else is. And so that's what you got to do, is just take
control. You feel a little more empowered now?
Right.
Yeah.
Right. Yeah, I put off going in for my broken leg just because of the cost. You know, I waited. I wanted to make sure that we were going to be able to cover it rather than going to the ER. I waited a few days and went to my doctor. Got a referral then to go in and get an X-ray. And
you know, and ultimately saving costs. That's a prime way that you actually wind up maybe costing yourself more. You could have run into an infection, and he'll tell you that. I mean, you're going to wind up now in the hospital for more things, and it gets worse and worse. And it's harder to treat.
Prepare yourself, too. Educate yourself. Be prepared for what do you do if you have an emergency as well. And, you know, use these tips to educate yourselves. Thank you for joining us, and thank you for your tips.
Sure. My pleasure.
And so there are a lot of people at home who appreciate those.